Hello everyone, I am Richa Sarah, Editor-in-Chief, Responsible Hospitals, and I welcome all of you on our Insta Live session. Today's topic is all about irregular uterine problems and irregular uterine bleeding. So we will be talking deep insights about that with Dr. Deepika Agrawal, who is one of the best doctor with CK Birla Hospital, and she's also been a gynec, colposcopist and obstetric surgeon. So we will be just getting her connected right now, probably in few minutes. I'll just try to add her ASAP because we are already starting our session, today's session a little late. So I'll just try to add her up. Guys, you have to be with me for another minute. I'll just try to find her up. Dr. Deepika, can you see me? Guys, I'll just try to add her up. I'll be soon starting the session, and in case you have any questions, you can just put it down in the chat box. Yeah. Yes. So the request has been sent by me. I'll try to answer. Hello everyone. Hi Prithvi. Hi everyone, whoever has joined this session. Today's session is all about the uterine irregular bleeding. We'll be talking deep insights about it because a lot of people they reached us out that they want to talk about this topic. So all the viewers who have already sent me the questions, we will be talking about those questions, and I'm sure you will be getting a lot of answers today that should be helpful for all the women. It's majorly focusing on the women part, so men, either you can help your sisters or parents or any other person, whoever is related to you in terms of women, because it is something which everybody goes through, every woman goes through. This is the kind of phase, but they have no idea, that how to go about it, whether it is right or why is it regular, what causes that, how to diagnose that, and what are the factors which made that happen, and in case is there any problems later on. So we'll be talking about those things sooner. So our guest is Dr. Deepika Agrawal. She's a gynec, obstetrician and colposcopist with CK Birla Gurgaon. She's one of the finest doctor I find. Just a second. Yes, so she's with us. Guys, she is with us and we'll be starting our session soon. I hope you will. Hi, Dr. Deepika.
Hi Richa, how are you?
I'm good. How are you doing?
Good, very good, very good.
Great to have you here, Dr. Deepika. It's been a long time. I was trying to do a session with you, and I think this is the time we are right now with us.
Pleasure is all mine, Richa, as always being with you.
Sure, thank you. So, Dr. Deepika, I've already introduced you, and let's start with because our topic is about irregular uterine bleeding. I would start with that. What is it all about? I mean, if you can just define that. Is it a problem? What is that exactly?
Okay, so I think Richa, irregular uterine bleeding, or what some people call it as abnormal uterine bleeding, it's something very common, especially in any age group, whether we start from the young girls or whether we start for women with reproductive age group. So normally a woman would expect to have regular cycles, which could be either lasting from a cycle 22-day cycle to 35-day cycle. As in medical terms, we call any period which comes either every 22 days or 35 days up to their normal. Anything that is not happening regularly, irregularly, is called as irregular or abnormal uterine bleeding.
Sure. So, doctor, let's go a little deep in it. So what are the factors do you think which cause, uterine bleeding, irregular bleeding?
Right. The most common reason young women can have this is because of functional problem. So what we called as the hormonal issues in the body. And something very common nowadays is called as PCOD. That is
Yeah.
something we are very commonly seeing. I think every 1 in 5 women that walks into my clinic, they do come across with the same issues. Either they are getting periods every now and often, or they may not be getting for 2 to 3 months. Now, the other reasons why someone may have is, and I'll talk about the most common scenarios. For example, if they may have any polyp inside the uterine cavity or inside the uterus, or fibroids. These are again two more common things that can cause irregular bleeding. And then comes more rare causes or uncommon causes like cancers, cancer of cervix or cancer of uterus. These could be the reasons also, Richa. Yeah. And
Okay.
I think I would like to mention here one very common thing that I have noted, and I do see some people coming in. If we are using eye pills, these are the emergency contraceptive pill.
Mm-hmm.
Sometimes people are taking eye pills, which is okay to take. For example, if we haven't used any barrier or there has been any accident, but that can occasionally cause some changes in the period in the next 1 or 2 months. So nothing to panic about it. So just for an information that you don't really need to visit your gynec if you have taken an eye pill and there is slight irregularity in the periods. Okay.
Sure. And is it really dangerous for women's health in case anybody is going through this problem?
I wouldn't say it is dangerous, but I think it is something that at least once they should visit their gynecologist so that we can exclude the causes and we can make a diagnosis for them, whether it's PCOD or if it's a polyp, then that definitely requires treating. If it's a fibroid, that needs treatment. Not all fibroids require treatment, but there are some, particularly the ones that are actually protruding inside the uterine cavity. Those are the ones that would require treatment, Richa.
Sure. So, Dr. Deepika, since you just mentioned that they should visit, I mean, what is the stage and when do you realize that this is now you require to visit a gynae? You should see a gynae now. So, when is that
Hmm.
time and what
If
are
it
your
is only
recommendations?
one period delayed or one period, then maybe I would suggest, and you are in a reproductive age group, young, between 25 to 45 years of age, you can always wait and you can maintain a menstrual calendar. But if this is something that is happening again and again for recurrent months, then you should see. Now, because sometimes we may have a very stressful month, we may have worked a lot during that month. In that situation, we should understand as women, our hormones can go haywire and periods can get deranged. Then there is no need to rush or panic. Just allow your body, to get back to normal. And but if it is something which is happening 2 to 3 months, then yes, you should see your gynecologist, especially if it is a new change in your body, something that has not been happening, and you're recently noticing it.
Absolutely. And it has been realized that people, they have a problem of, getting twice in a month, or they go ahead with 10 days or 15 days. Is that normal or is that also abnormal? And what do they do in that situation?
Hmm. I think there are two questions that you're probably asking. One is the period coming every fortnightly, and secondly, the period lasting 10 to 15 days. Am I right?
That's right. Yes, yes. Dr. Deepika, I'm losing the network. Can you hear me? Guys, I think there is a network issue. Yeah, I lost the network, Dr. Deepika. If you can just answer again.
Yeah. So what I was asking you was, I think you're asking two questions in that. One is that period coming every fortnightly, and secondly, that they are also lasting for 10 to 15 days. Both
That's
of them
right.
is not, am I right? Yeah. So both of them is not normal to have period coming so close together, and also if they are lasting for so many days. Most of the time we see that these are functional changes. it would be very infrequent that we would actually find any organic cause to it, like polyp or fibroid. But even if it is a functional changes that's happening, one should see that we would like to do some basic tests like check the thyroid levels, check your prolactin levels, screen you for polycystic ovaries disease, get an ultrasound scan done. And there is a lot of emphasis given for exercise and weight loss. If someone who's got a BMI more than 30, then it is strongly recommended, if the periods are especially irregular, to try and lose the weight, because women with high BMI will have more fat in their body, which means they will have more hormone called as estrogen hormones, and that can lead to imbalance. So weight loss plays a very, very important role in such women, Richa.
Okay, okay.
Okay.
And doctor, so if let's come back to the same thing, that irregular bleeding we were talking about. So, is there any treatment which is available which can actually, cure them properly?
Yeah. So there are different conditions. I'll talk about the most common polycystic ovaries first. Polycystic ovaries is mostly a lifestyle issue, right? It is related to pollution. It is related to the work environment. It is related to the imbalance in the work-life balance, right? So it can be treated. We can't say that we can reverse totally or completely, because once the lifestyle changes, the things might come back. The things that we can do, it depends on the symptoms. If it is just the irregular bleeding that is a problem, then sometimes we can start the women on hormonal pills. They are mostly oral contraceptive pills, which can be taken 21 days in a cycle, and that would help them regularize it, right? Equally importance is, when I normally start this, is I do tell the woman, please start exercising and losing weight. It would first complement the treatment. And secondly, if we are looking at the long-term resolution, long-term management, then that's where, it will play a role. When it comes to giving the medication, it will be effective as long as women are taking it. However, when we stop it, and if we haven't made changes to our lifestyle, things will fall back. Things will. So that is, I'm only talking basically in line with the irregular bleeding right now. Now, if it is a polyp that is causing it, there is no, unfortunately, medical treatment for polyps. It has to be removed by a surgical procedure. It is a small procedure, but it has to be done under sedation in OT itself. But yes, having said that, there is no medical treatment. Now, the third thing is fibroids. If the irregular bleeding is because of the fibroid, particularly the fibroid which are inside the cavity of the uterus, those are the ones that cause irregular periods or very heavy periods, that also needs to be removed. There are no medical treatments for that. There is no medications which will resolve that fibroid. So there are, for PCO, we can treat medically. For fibroids and polyp, we cannot. Then comes the rarer causes. We were talking about, like maybe cervical cancers or endometrial cancers. Of course, for that, you have to see your gynae oncologist, right? And then we have to really look into the detail and treat accordingly to the stage of cancer we are dealing.
Sure, absolutely. I think you have correctly mentioned that lifestyle also plays one of the, major role, and every doctor I talk to, they always recommend that, we have to focus on the lifestyle. So any specific recommendations, because we know that exercises are very important, the good diet is important, but people who are facing this issue, like, irregular uterine bleeding, for them particularly, do you have any tips so that they can actually have a good lifestyle and they can actually get rid of, including medicine, maybe they can do something about the lifestyle also?
I think first and foremost, the tip is it has to come from within. What I say, it's paramount for 3 to 4 days. There should be a will to do it, and there should be a lot of self-control. We don't have to start doing dieting or any rigorous exercises. Even if what we are focusing, that we are eating on day-to-day life, whether you are a vegetarian or a non-vegetarian, avoid any junk food. any snacking that we do in offices, eating like biscuits or mixtures or breads and all. Instead, one can start carrying healthy snacks with them. For example, they can carry nuts, they can carry some salads, they can carry a bowl of sprouts with them. Second thing is exercise. Again, one does not have to particularly join a gym. Even if someone is able to do running for 20 minutes, or they can do some yoga, which are online sessions, or they can go through another, the apps like Blender on YouTube. That is very, very paramount. For people who have high BMI, like more than 35 BMI or 30, they do sometimes need help from nutritionists as well. Because with PCO and irregular bleeding, it is very difficult to shed weight. They will have to work 2 times more to be able to shed equal amount of weight. So there is no harm to see a nutritionist who can actually help regulate some diet, Richa.
Sure. And doctor, is there any age which we are specific to, that at this age probably people get more into it or they get this problem? So do you have any specific age about it?
Generally, the irregular bleeding becomes more when we are. So first of all, it can be at any age. More so with the young girls when they are starting their menstrual cycle, and then at the perimenopausal end when we turn around 40. So women with more than 40 years or young girls will have more irregular period. Now in between is a reproductive age group. Nowadays, I can see a trend rising with irregular periods purely because of PCOD and the work-life imbalance. So essentially, we can see at any age, Richa. I mean, there was a time 10 years ago we hardly used to see irregularities, especially in the young reproductive age group women. But now it is kind of rising, unfortunately.
Hmm. And doctor, there must be some people who must be ignoring it, thinking that it is normal or let it happen, let it go. What are the diseases they can actually get if they ignore this?
So I think that's a very good question, Richa. What we do need to realize, irregular bleeding with PCO does come across with the risk of developing diabetes later on, hypertension later on, and also endometrial cancer, which means the cancer of the uterus. So if we are ignoring, first of all, we might be ignoring any sinister issues currently itself when we are going through it. And let's say if we are not having any current issues, then also we are increasing our risk of ending up, things like I just mentioned, diabetes, hypertension, cancer, and also risk of infertility or subfertility. With PCO, women who have irregular periods and all, there is a small association of infertility. So it is very important. If we have seen a doctor before and if we have been guided properly and if we are following the advice, we are reducing our risks of complications in future as well, Richa.
Absolutely, absolutely. Doctor, one question, I don't know if it is relevant with this subject, because there are a lot of people, they get it on time, but the problem is they get a lot of pain during that. Is that normal,
Mhm.
first of all? They say that,
Yes.
I get very serious, the pain is so much that it is not tackleable, not tolerable, and they keep on bearing that pain. They take mephtal spas or any other medicine to keep it stable. But this is a monthly activity for them. Is it normal or is it something which they need to see a doctor?
Yeah. So, and I have to say, having pain during periods is a normal physiological phenomena, right? What I see, there is a very strong cultural myth in India that we have is a lot of women don't take painkillers, Richa. I have seen that. Now, for some reason, they have been told or misinformed, I don't know, by their peer group, friends, family, that taking painkillers from early age in pregnancy, especially during periods, might compromise their fertility. That is something I very
Yeah,
commonly hear, or might compromise their periods, right? But that is not true at all. That is absolutely not true. And we know pain is something common. It can happen. In fact, the more younger we are, more pain we can experience. Like, when the menarche starts, period starts, initially 1 or 2 year we may not get pain, but when we start ovulating, start producing eggs, we can get pain. Now, the most important thing is to take painkillers on time. Again, we are in a habit of deferring taking painkillers, and when actually it is at peak and unbearable, and we are doubling up, or we are really not able to bear it, then we take one painkiller. Now, that's the time it is not going to be much effective. So, and unless we take it at the time when the pain is just starting, then it will actually take the pain down. It will actually. So please, if you suffer from dysmenorrhea, which means painful period, please take some painkiller. You may want to take meftal-spasm. You may want to take brufen. You may want to take combiflam. They all work well. For some people, brufen will work. For some, combi, or for some, meftal will work. But there is absolutely no harm if in a month's time, for the day first, you are taking it.
Sure, sure. So there is no problem certainly having that pain. That is
No.
normal.
Yeah. Yeah. If it is a new pain, for example, if someone was not having painful period and now all of a sudden it is developing, then yes, they do need to get checked. Why is it happening? But if it is something that has been there with us, then I wouldn't really worry about it. There is nothing wrong.
Sure. So let's come back to this our main topic. So what are the tests which are available and which are required to check on the irregular bleeding?
It depends on the clinical condition what we are suspecting, right? If we are suspecting PCOD, there are hormonal profile tests that we would like to do. It includes so these are the hormonal levels, like LH levels, FSH. We like to check insulin level, testosterone, which is a male hormone. And then there is a level called as DHEA. Sorry, these are medical terms, but there is no common language I can use for them. We would like to check your thyroid levels and prolactin. Prolactin is a hormone that gets released from one of our little gland behind the brain called as pituitary. So that is for PCO. And we would also like to do an ultrasound scan. In sexually active women, it is done vaginally. And if someone is sexually inactive, then we would do it from the tummy with bladder full. The other test, now the ultrasound scan will help in diagnosing polyps, fibroids, and polycystic ovaries. If we are suspecting, your gynecologist would like to do an internal examination by doing a speculum to check inside the cervix whether there is any growth on cervix, whether the cervix looks normal or not, right?
Okay.
Further, when we come on, in some patients, depending on the reports of ultrasound scan and history and age, particularly women who are more than 40 years of age, and if they have thickened lining of the womb on scan, we may want to do the camera examination of the womb to check the lining of the womb and make sure that it is there are no sinister things happening. And we also like to take some sampling, jisko hum endometrial biopsy. It is called as endometrial biopsy or endometrial sampling. And we send those tests for examinations we want to make sure that cells are not getting abnormal, and we want to exclude any cancer cells or any sinister cells in that. So these are the basic investigations that most of the gynecologists will be doing. Again, it just depends on how we have assessed the patient, what is the examination finding, and what is the history.
Sure. So, doctor, you have beautifully mentioned everything, every aspect of it. So, I want to know now that so there are treatments available for it, as you mentioned. These treatments have any side effects which can happen later on?
So, see, what I always say is there is no such drug which doesn't have side effects. Whatever we'll take will have some side effects mentioned in their brochure. As clinicians, whenever we prescribe medications, at least in my practice, I always balance the benefits versus risk. Most of the medications that we are giving, particularly to regulate the heavy periods, like Trapic, tranexamic acid, they are very safe to take. Then contraceptive pills, again, they are very safe to take because they are low dose pill. But some people might experience, 1 or 2% of people might experience things like headache, mood swings, breast tenderness, or they may not be effective to them, right? So these are the things I would mention to my patients. when I'm prescribing them the medications. And again, if to some we think that there is more advantage that they should take pills for 4 to 6 months, then it's better to take them. It's better to take them. But when we talk about long-term side effects, not really. Whether we take OC, so one of the myth that I hear very commonly here is if we are on oral contraceptive pill, that might prevent us from getting pregnant in future. That might compromise our fertility. Again, that's not really true. Fertility does resume. It may take 1 or 2 months, but it doesn't make us infertile or subfertile. And the
Okay.
other medication that is taken just to reduce the blood flow in women who have heavy blood flow, that is tranexamic acid, it doesn't really have side effects because it is taken only for short term. So essentially no long term side effect. But if someone is getting short term, then we can always change the medication and we can try some other combination.
So this can be entirely treated with the medicines.
Uh, Not PCOD. PCOD is a lifestyle disease. We can manage it, right? And we can keep the symptoms and issues at bay as long as we are managing our lifestyle. Otherwise, it will come back.
So in the case, let's say if the medicine doesn't work out, what is the other way around? What is the next step?
For PCOD, usually in my practice, what I have seen is if my patients are religiously doing exercises and losing weight, it does work. It always works. But then there are surgical treatment as well, where we can do keyhole surgery, and we can, because there are multiple follicles in the ovary, we can try and buzz the follicles, which again helps in balancing the hormone level. That particular surgery is more effective or more advisable in women who are planning pregnancy also, Richa, just to help them, right? I wouldn't recommend them to women who are having just irregular periods and who want to regularize, not for them particularly. Okay, because it is physiological having irregular. Then for them, the things that we can use is coil insertions. So there is a hormonal coil that comes, Mirena coil. So that is
Okay.
something again we would want to try in them. It helps in thinning the lining of the womb. It really reduces the flow, so much so that it can just remain to spotting or no blood flow. Again, it doesn't really makes us infertile, or it doesn't really affects our ovary. It's just that if somebody work life balance is totally gone haywire and they are every now and then having period, then it's better to have this coil insertion done and try a coil, Mirena coil, which
Absolutely.
is again very commonly used.
Sure. So, I mean, the kind of intensity will definitely help them to understand what the kind of procedure a doctor will take, right? That's what I have
Absolutely. I
understood.
think these are the options the doctor will discuss with their patients. So we normally try to do conservative treatment first without not much medication. Then we'll go for the medical treatment. Then we would want to try Mirena. And last but not the least is the role of surgery in that.
Obviously,
And
right.
again, which I must emphasize, all these things are age dependent. Treatment for
Right.
a woman who's 45 year of age, who's having abnormal bleeding all the time and not responding to medication, hysterectomy might be the course for them, which means removal of uterus. Uh, for more younger ones who are between 35 to 40, we may want to suggest using the coil to them. Then, we have tried medications. Now you can go for a Mirena coil. So again, it is age dependent, it is symptom
Absolutely.
dependent, and it is patient's choice also. Sometimes
Sure.
I do get women 45, 46-year old, they say, no, we have been suffering for many years. I really do not want to have uterus. Please, I do a hysterectomy, then at least I will never have this thing. On the contrary, I do get women who says, I do not want to have hysterectomy at all. Okay, I would want to try Mirena coil and at least give it a last try. So I think to me it is paramount that I involve my patients in their care. It's not about what I feel, it is about how they want to lead their life as well, Richa.
Sure, I think that's how the doctor performs, and that's how the ability of doctor counts here, and I can trust you on that. So,
Thank you.
doctor, my last question of this session is that what are your tips to maintain good reproductive health for the females?
Right. So I think what the most important, what I I'm a very conservative person when it comes to managing reproductive health. The most important thing is staying fit. Richa. Staying fit could be by doing your aerobics exercises, but then yoga plays a very very important role when it comes to reproductive organs. And if we have a good yoga instructor, and if we are doing our yoga religiously, it really helps in stimulating our reproductive organs, especially the ovaries and the uterus. And you would hardly find any period problem issues with that, to be honest with you. And let's not play around with our reproductive organs by taking hormonal pills, by self-medication, because sometimes we
Absolutely.
see a gynecologist, they tell us about some treatment, and then we start using them without any supervision. So we shouldn't really be doing that.
Sure. I think it was a great learning session, Dr. Deepika. Anything else you want to add on which I missed out? Certainly.
Not really, you haven't, but I think there is one important thing, since we're talking about irregular bleeding and we just mentioned about reproductive organs. The cervix is very, very important part. Just as an information awareness, I would like to, most of you would be aware who are listening today and are with us, but please do understand importance of pap smear. Pap smear is done as a cervical cancer screening test. And this is to prevent the cervical cancer. It has to be done every 3 years from the age of 25. So if you're someone who haven't had yet done and you fall in that age group between 25 till 55, please see your gynaec. It is a simple OPD procedure. It's a simple brush test that we take, and it prevents us from one of the very deadly and most common, cause of of women's death in India, cervical cancer. Most of us are aware of breast cancer. We regularly go for screening after the age of 40. We are regularly palpating, feeling our breast, but it's the cervix we are not. So please do see. And now there are vaccinations also to prevent the cervical cancer. So please, seek information from your general practitioners or your gynecologist. It is really important, these two things.
Sure. Thank you so much for such great information. I think this is a learning for every woman that they have to go for these pap smear test. It's a very simple, basic test. Also, people who are in the initial age group, they should get this, cervical vaccinations done, because that can actually simplify your life, and you can actually be on a very positive style, and you can live happily and long life. So better to do that sooner. And rest, I think the information was very clear. So in case any of you is facing such challenge, you can get connected with Dr. Deepika Agarwal. She's available in CK Birla Hospital, Gurgaon, and she's a fantastic doctor and can help you throughout to understand any deep insight about it. So thank you, Dr. Deepika, for such an insightful session. It was really great to have you here.
Yeah. Thank you so much, Richa. So it's always a pleasure, I said, for being with you. And have a lovely evening, all of you. Thank you,
Thank
Richa.
you.
Thank
Thank you
you.
so much.
Bye-bye. Bye.